The next thing I want to talk about is fluoride varnish. We've been using this, but we've used 4 or 5 different varnishes over the years, but my hygienists are so excited when they started with this particular one because the kids actually like the taste. So with varnish, the indications for use are desensitizing, especially exposed root surfaces, treatment of cervical defects, and treatment of enamel and enamel defects. When we look at all the different fluoride options, if we decide, we've got a problem with sensitivity or a problem with caries activity, and we want to do something about it, our options are trays, in chairside trays with fluoride foam. It's good because it's cheap, but anybody that's used this in their practice knows that patients don't like it, especially little kids. We remember we used this 20, 30, even close to 40 years ago, and kids were constantly gagging and throwing up, so that was something that we didn't care too much for. The fluoride gels aren't much better, and especially if you put them in a tray, you get the exact same response. They're inexpensive, but you just don't get a lot of fluoride release, and it doesn't stay on the teeth long enough to be very effective. The fluoride rinse is also not that effective, so you get very small amount of fluoride release. Even in-office rinses, especially if the patient only comes in every few months, 4 to 6 months, then you're not going to be able to get them to rinse enough to be very effective. So toothpaste, of course, is probably the best source of fluoride because we can have our patients use it 2, 3, or 4 times a day, every day. So that's one of the most important things that we recommend to our patients is always use a acceptable fluoride-containing toothpaste. And the other thing that we started when it first came out was the fluoride varnish. Varnish is so much more effective because it stays on the teeth for hours, and you have a high percentage of fluoride. The only real drawback is it costs a little more. So the ADA says that this varnish is effective in preventing caries in primary and permanent dentition of children and adolescents. And they also continue to say that it takes less time, creates less patient discomfort, and achieve great acceptability than does the fluoride gel, especially in preschool children, which I agree totally with. So the Voco product that we're using now, we like because of several things. It's got plenty of fluoride in it, and we like the way it adheres to the teeth. The resin base comes from pine trees. It's just like pine resin. And the good news is they figured out a way to get the bad taste out and actually make it taste pretty good. We like the application system. It comes in a little single-use delivery system that you peel back. There's a brush inside the package. You simply pick up the brush, stir the material up, and apply it. It sticks to the teeth well. It stays where you put it. And it comes, I think, in 4 flavors. And our kids really like the caramel flavor. So again, the benefits are the white color, so it doesn't look bad on the teeth. You can't even see it. It sticks to the teeth, and it stays. We also have a high immediate fluoride release, so we know it's about as good as we can get as far as actually making a difference and helping the fluoride to reach the enamel and stay there. It also contains xylitol as a sweetener.